So, welcome everyone to another episode of Presenting Our Presence. We're honored today to be here in circle with you, the audience, alongside each of the co hosts and our guests. So, my name is Florence Glanfield. I serve as one of the co hosts for Presenting Our Presence, and I will invite my co hosts who are joining with us today to introduce themselves, and then we'll invite our guest to introduce themselves in the way that makes most sense for them. So, Michelle, good morning or good day.
Hello. Hello, everyone. My name is Michelle Durocher. I'm from the Fishing Lake Métis settlement, and I'm the operations coordinator here at the U of A in the Office of the President. I'm really excited to be here today and to learn more about our guest and hear their knowledge and what she's here to share with us. And I'd like to hand it off to our friend Kyle to introduce himself.
Merci, Michelle and Florence and Paulette. I'm very excited to hear a bit more about your story shortly. Honored to join you from River Cree today. So merci, and Paulette, I'm so excited to join in this discussion. And it sounds like, as Florence was alluding to, it sounds like we'll hear a little bit more about your research work today.
Well, thank you so much for having me. I have enjoyed the POP podcast for a couple of years now since I started my graduate studies. My name is Paulette Dahlseide. I am from Cold Lake, Alberta. That's Treaty 6 territory of the Cree and Dene people, and some of the homelands of the Métis people where my family comes from. My dad is a French settler from Bonnyville, Alberta, in the Francophone community, and my mom is Métis from St. Paul de Métis. Her name's Annette Lacombe. She's the daughter of Millie Lacombe, and Millie is actually the great-granddaughter or the granddaughter of Laurent and Eleanor Garnham, where our river lot was here at the University of Alberta. So U of A is really an important place to me, and my family's history with the Métis and the Métis Nation here in Alberta is also really important to me, to who I am, and why I've come back every chance I can to study at the University of Alberta. I have a diploma in dental hygiene from 1994 at the U of A, my Bachelor of Science at the U of A in dental hygiene specialization, and I just completed my Master of Science in dental hygiene and convocated and crossed the stage on Friday. So happy to be here and just chat with you and just rediscover together what we can do in the field of oral health and for our people. So thank you for having me.
Thank you so much, Paulette. And I invite you to start. I'm so curious about what took you into the work of dental hygiene originally, and how is it that you have shaped your career in relationship to the work that you've just completed a master's degree. Congratulations. That's so exciting. So perhaps you could tell a bit of the story of how did you come to think about dental hygiene? A little girl who grew up in Cold Lake, a little Métis girl. Mm-hmm. What's the story you tell?
Okay. Well, I kind of fell into it. I graduated from Bonnyville, small class, graduating class. And we went off to university. It was understood that my girlfriend and I shared a room at Lister Hall, and I went into Faculté Saint-Jean actually, and did my first year in a Bachelor of Arts through the faculty. And while I was there, another friend of mine, she got into dental hygiene. So it was a diploma program at the U of A in the old pharmacy building, beautiful pharmacy building, and I was one of her patients. And so as I was sitting there in that bustling dental clinic room as a patient, I looked around and thought, hey, this is interesting. I could do this. And that's what started my relationship with dental hygiene. And actually, until then, I didn't even know dental hygiene was a profession. We only went to the dentist when we were in pain, when we had those needs, those unmet oral health needs. So I knew that there was a dentist, there was a dental assistant, but I actually wasn't aware of dental hygiene until she was in that program. So that was a real blessing to to have it come together that way, which I find in my life is just the way that it all comes together for us.
Wow. And so you became a dental hygienist with the
Oh,
diploma, and then you decided to do a bachelor's degree. Like perhaps people aren't aware that there are these two programs because I certainly wasn't until I met you
that's
those
right.
few couple of years ago. So maybe you could just
Yes.
talk about the difference between that.
The scope of dental hygiene has really evolved, and through some great work of the dental hygiene, the dental hygienists that have come before us. And uh, we were a diploma program, I think, or we celebrated 60 years of dental hygiene not that long ago at the University of Alberta. We were a diploma program, and then in the 2000s, we became a Bachelor of Science degree. When I graduated in 1994 from the diploma program, my dad, who's always been an entrepreneur, said to me as I gave him my degree, he said, "When are you going to open your own practice?" Well, in 1994, that wasn't even a possibility, and yet that's how we think. And so he was already looking forward to that time when I would be able to do that. And so in 2006, when it became possible, within 4 years, with my dad's help, helping me haul equipment and set up my clinic, and I did open a mobile dental hygiene clinic, and then eventually a storefront dental hygiene clinic in our community. And so you kind of look around, who's going to be. It's dental hygiene is different. Independent dental hygiene practice is different than dentistry. You don't hang your sign on the door and people come flocking to you because, like you said, Florence, nobody even knows that independent dental hygiene was a thing. And so I looked around, who was I going to serve? Well, that only makes sense. I would serve my community. And so I started off looking to the schools at Elizabeth Settlement, where my parents were living, looking who are the people in public health that are not being served, the seniors, the children, those are the two ends of the spectrum. And so I started working in long-term care facilities. I went out to Elizabeth and Fishing Lake, Michelle. I worked at JFD on school, extending it into Coal Lake First Nations and Frog Lake First Nations. And something amazing happens when you bring that service delivery model to community. Um, it breaks down so many barriers. It honestly was the best part of my career as a dental hygienist, being able to go and work in the schools, and then also being able to create those safe spaces in town at a storefront clinic. And so I did that for many years. From 2010, I opened on my birthday in 2010, and the clinic still runs today. But and so after starting that in 2010, I realized what I didn't know. And that's when I went back to the university through distance education and did my degree completion. But it's also connected in how I find myself, where I find myself right now. And so when COVID hit, I lost 50% of my practice because we couldn't enter the schools anymore. And that was, just like any good Métis, you're going to redirect and adjust. And so I thought, well, we need more evidence that this service delivery model that I've been doing works. And so then I looked towards the master's program. I reached out to Dr. Sharon Compton, who's always been a mentor of mine, and she was more than happy to help me in pursuing that master's in dental hygiene. So, yes.
Well, I'm just going to jump in, Paulette, because the I loved the weaving of the story because I did have Michelle and Kyle. I did have the honor of hearing Paulette talk about her master's work, and I see the narrative coherence now between the lived experiences of operating your business, going into communities, and the work that you've now done for your master's. So I'm wondering if you could just share a bit about that that story of your master's work, just so that
Mm-hmm.
people can, all others who may not know you as I have come to know you, can do this.
Well, thank you. Absolutely. Um, so a very wise woman named Dr. Cindy Godet once told me that a master's program is about mastering yourself and taking that time to really listen and here, and that moment of self-reflection. And that's really what happened. When I entered that master's program, I knew that I wanted to work with community. I wanted to bring, um, I wanted to center some of our Métis oral health experiences that I was seeing every day anecdotally in the clinic. But I also didn't know what I didn't know. And so I went in and I took my early quantitative, qualitative research methods class, um, those first master's courses that you have to do. And I still didn't really see us. I remember the qualitative course, the prof, he was talking about epidemiology, ontology, axiology, all words I couldn't say, 3 years ago. And he very pointedly said, "What is truth?" And I had to really start thinking about what my worldview was. And as I think as Métis for myself, I experience it so intuitively as who I am. And so then having to take the time and think about what does that mean for us, and what's my purpose, and why do I want to look at this? It was it naturally led me then for my electives. I went looking for help in figuring out that for community and for us. And then I was led to the Faculty of Native Studies, where I took Native Studies 590, Indigenous methodologies, and it all started to come together, as it probably should have. And I was introduced to the visiting way through Cindy Gaudette's work. And I remember telling people when I was first starting my master's that I was having so much fun visiting all the scholars that I was reading in that class. And I felt like I knew them. And then now I have the honor of actually knowing so many of them in this beautiful network that we have, like through POP and the Indigenous community here at the U of A. So after working through why I was going to do what I was doing, why was I drawn to what I wanted to do, that led me to then go back to community, and I could stand on who we are, go back to my kinship group. I also have the privilege of serving as the New Dawn Métis Women's representative in our district. And so I have this web of kinship with some most amazing women across our district in District 12 in Northeastern Alberta. And being able to then walk with them in this journey of research where we could bring our Métis oral health experiences to the forefront, center them, and let the world know, come against that erasure of nobody knowing who we are as Métis people. Our oral health statistics don't exist, or they're locked in with the pan-Indigenous oral health surveys. There is no First Nation Métis or First Nation oral health survey or Inuit oral health survey. There's no Métis oral health survey. There is First Nation and Inuit, I mean. And so I didn't see any of us in the data that in the data, in the learning in the faculty of dental hygiene. And so we together got to do that. I got to share in their stories, and through that lens of oral health, I just got to visit with the women and do what we do best. And so that was it was a great process. It was a lot of ups and downs and tears, blood, sweat, and tears, but it was all good and for good. And always so much to learn, and just to be validated in my identity as a Métis person. We all know that our identity is very linked to our wellness, and it's very linked to our oral wellness as well, our oral health. And so to celebrate those things and really focus on what we do well to take care of each other, it comes through in the oral health discipline as well. And so it was a gift to reconnect also with my own mother and celebrate with her. Because through that work and the way that they teach, the way that Dr. Van Stuyvendale taught Indigenous methodologies really awakened. She called these germination assignments she used to give us. And it would awaken this creativity and thinking very much about how my creative side was tied to who I am as a Métis person, whether that's playing guitar, at jamborees, or or braiding rugs with my mom is something my grandmother had always done, braided rugs, and realizing that she was a researcher. My grandmother was a researcher. She searched for high and low through secondhand stores for the right materials, and she made sense of her world. She provided for her family, making these beautiful braided rugs. And to celebrate her abilities and to really show that there's so much learning and wisdom in the process of braiding rugs. Then I came together when it was time to make meaning of all of our visits. We came together as a group and we braided together all our stories to present this rug of understanding about our origins.
So first of all, thank you so much for sharing that part of your journey, particularly into your master's research. I'm really fascinated in this aspect of your master's, which is unmet needs, because there are so many myths around Métis individuals and access to healthcare and dental care. And I know, at least in my community, and hearing from other communities, that there has been a torrid history of dental care from there's a lot of elders who of a particular generation who had their teeth removed at a very young age, all of their teeth removed. And so, whether it's that or whether it's predatory dentists, or, there are so many different things that counter the myth of just ubiquitous Métis access to healthcare. So I want to hear about this aspect of your research, and then how it is that your practice has been able to respond to those myths.
Thank you, Kyle. That's a very thought out look at the complexity behind what we actually call it it's a wicked problem, the oral health inequity, right? And there's a lot of intersections, socially, politically, corporate, economically, behaviorally. But what I found was, yes, our stories, we did display, there was intergenerational dental trauma, like you were speaking of, an aversion then that becomes part of our lifeblood, an aversion to that trauma, because it's stories of not having our agency respected, our sovereignty, especially in the elders. There was some, I found the younger women, the younger generation, and when I say younger, I mean our 40s and 50s, but our younger ones listening to the grandmothers, just sharing stories matter-of-factly about what happened to them, and us hearing them in our generation as what they were. They weren't, it was violent, some of the treatment that they received, but it was just a matter of fact history for them. And just really hearing those traumatic experiences, that was difficult, but it wasn't what we focused on either. We were able to, change the unsafe service provision histories that had happened, and then also see though how it was changing. It's like for all of Canada, oral health has improved because of economics, because of technology improvements. So Canadians as a whole have experienced better oral health than they did back in the 50s and 60s. They've experienced less pain than they did back in the 50s and 60s. But those gaps still exist for Indigenous communities. And because of the systemic barriers, the lack of cultural safety and just not understanding our needs. There was stories of discriminatory microaggressions and all those things. But what we did well as a group is we visioned how to improve oral health care and look at the relevant supports that would strengthen what we do well. And so when you strengthen women's kinship systems and you vision together what that's going to look like, then you see we travel miles and miles and miles to go see providers that are relational, that are holistic, that they get to know us, who we are. It's we know that we have a relational way of being, and so we show loyalty then to those relationships, those good relationships, when providers are non-judgmental, when they take the time to hear our stories, when they share their stories with us. I say that to the students that I teach in the clinic. I have the honor to be able to work in the dental hygiene clinic and do some clinical instruction. And I say, every time somebody sits in your dental chair, that's an opportunity to visit. So it's not just what you can give to the patient in terms of treatment. You're sharing a piece of yourself, and then that creates a good relationship with it's the principle of good relations. And so just being able to bring that understanding, I think, changes the face of what our oral healthcare systems can look like in the future, is bringing back who we are as a visiting people, bringing back celebrating what we do well, which is relating to each other, taking care of each other, understanding the reciprocity of the provider-patient relationship. That'll change those stories and help improve those outcomes for our communities. And but also, as Métis people don't know what our stories are. They don't know what our needs are. Nobody's ever asked us. There's been no funding given to it. And so if they don't know, how can we target programs and policies if we don't know what our needs are? And if you don't ask the grandmothers and the aunties, which is what I did sitting in those circles with those women, then how can we actually affect proper change or better change? So yeah, so many great things came from this work, and I think it's hopeful. And when you look at the literature, you see some really amazing Métis women's-led research happening right now. Well, I'm doing a research internship with Dr. Godet right now. We're looking at a scoping review of Métis women's health and wellness, and just being able to see these themes come out where we are centering and reclaiming the knowledges that our aunties and grandmothers had to take care of ourselves. And when you do it differently, you hear different stories and you see the positives. You're not looking at just the deficits. Dentistry has looked and counted our disease, our cavities, our periodontal disease, tooth loss far too long. And if we focus too much on the negative, then we just perpetuate ill health and bad oral health.
One of the things I was thinking of when you were speaking was that when you start talking about being in community and everything, and there was a moment where I was like, I remember that. Like, I remember being in elementary school and having dental hygienists come and they came and they checked everybody's teeth, and you got a little pack of some floss and a toothpaste and a toothbrush. And that's like, my introduction to oral health, I guess, was in my elementary school at JFD on school. And as you said in earlier in your introduction, we think of oral health as only when we have a problem with it, right? When I have a toothache, something hurts. That's kind of been the way that, I guess, not even just Indigenous people in general think of their oral health is, I'll go when there's a problem. When you're doing your work in community, when you're doing your clinics, how do you find ways to kind of break that way of thinking among our people? Because like I said, like I remember the hygienist coming once a year when I was a kid. And then I probably didn't really go to the dentist until I had problems up until I was in university. And now as an adult, now I'm like, I go every 6 months because that is what makes sense and that will help. And that, is preventative. But I know that that's not the case. Not everybody has access or insurance to kind of cover that kind of thing. So how do you help people kind of leave behind that idea of this is only to be done when there's an issue, and how do you help people get through that way of thinking?
Wonderful. Yeah, that is you've put a pin right on the whole profession of dental hygiene because we are the prevention specialists is what they used to call us. But I just have the privilege of walking with people on their oral health wellness and journey. And part of doing that really well has actually been that time spent in the schools. And when I would go to Elizabeth School and JF, I didn't go just once a week because I I I, I just became part of almost like the staff in some ways. I had that privilege of joining in. At Elizabeth, I would get to judge the Halloween costumes. It was, things like that. I was part of their fabric. And when you place dental hygiene and oral health prevention um, in the schools, when you think about the time children spend in school, they spend more time in school than they do at home sometimes. And so when they see the tooth, they used to call it the tooth van. I had this little white um, Sprinter van, Dodge Sprinter van, and they'd say, "Oh, the tooth lady is here," and they, or I'd be in Walmart and they'd come running up to me and doctor, doctor, I did brush my teeth today. It becomes part of normal routine, and it normalizes um, good oral health care, and so it's synonymous with spending time uh, going over toothbrushing. When you are in pain, those aren't the appointments where you go and learn how to brush your teeth, or somebody says, "Oh, I'm noticing that um, there's heavier plaque here in this upper corner. Let's take a look at how you brush and see how we can maybe adapt to those things." And so it's discovering together what can be what will work for it's patient-centered care, really. Um, but without the trauma of I have the benefit of not instilling or putting a lot of pain on patients for the most part. I mean, that's what my goal is to have a good experience, right? And to create positive oral health experiences so that people want and good relationships, so they want to come back for those appointments on a regular basis. But being able to go in to the schools, I was a presence, at least monthly, for a few days at a time. And so it creates good relationships, and the students want to share what's happening in their mouths. And it allows the teachers then to also reach out and say, "Oh, I've noticed Johnny can't sit still in the chair and he keeps holding his, do you mind taking a look?" And so, reach out to the parent and say, "Sure, I could take a look." Get on the phone and they take a look, and oh, he does have an abscess, and that's going to affect their learning. There's so many layers about delivering oral health care in the schools. And you're right, Michelle, it used to be far more commonplace in earlier generations. But because of those tensions of federal, provincial uh, expenditure in terms of oral health, public health initiatives, that's come and gone. And there's these, and then so unfortunately, and that was one of the things that my research showed, is that uh, the whole generation of us in our 40s and 50s we recognize that our children and our grandchildren are not getting that same care because the changes in public health care expenditure and oral health programming. So we miss that then. So that reliance on private economic models is difficult for patients to then create these deep relationships where you see oral health prevention as normative and positive. And yeah. So I hope that kind of answered the question in terms of oral health prevention and why I love to be on that end of the spectrum in treatment.
Yeah, that's wonderful. Thank you so much. Yeah, because like I was saying, I know that even within my own family and the kids in my family, that it's something that is it just seems like they need more guidance on this kind of stuff, which is fine. Like that's fine. That's what we're here for. That's to teach and to help think and encourage. But one of the things that I was interested in as well is that you're part of the dental clinics, right? So that are currently going on. Which kind of what kind of communities are you going to right now? Are you going back to Indigenous communities, or are they kind of larger areas? And yeah, just curious, where's your work taking you these days?
Um, so like I said, I do have my private practice in Cold Lake, my independent practice. So it's storefront. Well, through this period of going back to school, I didn't restart the school programs where I was going into Cold Lake and Frog Lake and Fishing Lake and Elizabeth because I want to be sure that I'm going to be committed and that I have those things in place to keep those relationships going. Um, so I'm not going back to the schools, which actually is hard on me. I miss that. Uh, I work 1 day a week in my clinic. I have another hygienist that works, and we have a very we see patients from all walks of life in Cold Lake, and we have patients traveling from far away to come and see us too, because we really work on that accessibility and acceptability of care and having those healthy spaces. And I also have, like I said, I get to work at the University of Alberta in the K clinic. I don't work in the K clinic this year. I actually worked at the Glenrose clinic where the students would come to learn, and in that hospital environment at the Glenrose with patients with different needs, which has been a wonderful experience. I really enjoyed working at the Glenrose and learning together with the students to help those people that are coming there through rehab or through all kinds of uh, other medical needs. So was neat to watch from 2010 when I started to 2020 when I ended. That's somebody literally I watch kids grow up from kindergarten right up, right? And so by the time every year I'd come back with I'd have to work on these new PowerPoints. And by the time I got to grade 9, they would come back to me with what they knew because they've been learning it all year, or, all along. And so, but you were always trying to figure out what else can I share. And I even did just because you can doesn't mean you should. A whole thing on tattoo, how to be a smart consumer in tattoos and piercings, because a lot of piercings affect that oral health region. And just watching the students grow. And now the other part of that is to have them bring their children back to the clinic to see me too. And so that part of oral health prevention has been so good. The other thing, and I'm sure we can get into it, maybe not this one, but is my work with the Access for All dentistry team at the university, which is a student-led access clinic that goes out in partnership with the Tupenswag Métis government here at the Métis Nation in Alberta. And we have had 5 clinics now in Métis communities. It's been phenomenal. It is a great experience all around for everyone. The students are learning, the community is learning, and we're creating these environments, clinic spaces that are completely relevant and specific to who we are. And we're giving back to the students. There was one of the ladies, she hadn't been to the dentist in many, 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 many years. But through the visiting spaces that we created alongside the clinic, we were playing cards with the students when they would come in. We would eat lunches and meals with the students when they would come in. And as she got to know the students, she decided that yes, she would sit in their chair so that she could help them learn. And then of course they were able to help share their knowledge and the dental services that she needed. So there was a beautiful reciprocity and an equal reciprocity in that relationship. And and that was a collaboration. It's a very exciting thing to be part of Access for All, because it is community led, but also student driven. It's an amazing synergy of oral health.
Wow. Thank you, Paulette. The stories you shared with us today are just beautiful about the work you're leading, about how you've come to the work, and the ways in which you're contributing to the Métis specifically community well-being. Really appreciate the time. It is time for us to come to a close, and I would just invite my colleague Michelle to also express their gratitude. And then we invite you to close this session of presenting our presence in the way that you would like to close it. So, so much appreciate the time that you've spent with us today. Much appreciation.
Thank you, Florence. Yes, Paulette, I'll just echo Florence's gratitude. Thank you so much. I'm really interested now to learn more about this Access for All program. So we can get into that another time. We have more episodes to do, more people to include in this pop world. So we're very excited for that. So thank you again so much for sharing your stories and your knowledge. And I really look forward to having more chats with you and learning more. So I will leave it with you to continue and to send off.
Okay. Well, thank you so much for having me. What an honor to I have listened to so many pop episodes, and to actually be able to sit here and visit with you both, and with Kyle, that was just wonderful. And also just to bring to the forefront oral health. We kind of that long forgotten piece of health, and we actually are the window to the soul, our oral health. And just being able to blend everything I love, is Métis, being Métis. I was given a purple sash from the grandmothers of Les Femmes Pemswak, and purple's the color of dental hygiene. And so and being here at the university on my ancestors' land, just everything, just to be able to share that and celebrate with you all and reflect on that, I thank you from the bottom of my heart, letting me do that, and being able to bring community and my community and our experiences to the university. Thank you.